Okay, here's some more advice from the ER. Bringing children with you. Some people bring their children with them to the ER, which is totally fine, whatever. But please, my advice to you from a nurse that works in the emergency room, do not let them play on the ground or really anywhere in the ER. You kind of have to like hold on to them or keep them on the bed with you or on your lap, which I get is hard because I'm a parent myself. I have a toddler and a 2.5 month old, and I get it. But I'm telling you that it is a disgusting place. We talk about nursing being short staffed. Housekeeping is even worse, especially at the hospital I'm at. Like, there's hardly ever any housekeepers around. So, guess who absorbs that job? The nurses do, or the staff. And we're so busy that sometimes we just don't have time to get to that. And so it gets neglected. And the things I have seen, especially in like the waiting room. The hospital obviously is for sick people. So you're going to have sick and injured people there. But other things like, I've seen people spill alcohol bottles all over the place. I've seen them smoking drugs. I watched one dude in the waiting room one time, in the middle of a full waiting room, dump out a line of Coke and just rail a line in front of everybody. And it was like straight out of a movie. He had like white powder on his face stuff still. And like, people have urinated all in the hallways, on the floor. There's been diarrhea. I mean, it's just a cesspool of nastiness. We obviously have people coughing, and you're gonna have blood and sputum and other like bodily fluids. There's also people in the hallways that are sick. Like, we don't have enough rooms for all these people, so I mean, we're putting like flu patients, RSV, like that kind of stuff in the hallways, which aren't good for kids to get, right? So you think daycare is bad? Like, if you take, like, I can take my son to like we do Sunday school at church, and it's like almost every other week he comes home and he picked up something. The ER is 100 times worse. Like, you are guaranteed going to be bringing back something with your child if they're playing around. And I mean, just bringing them in general is a risk. And I get it. Like, some people don't have like childcare that they can send them to when they have to come in, or it's an emergency situation. And I get it. I'm just letting you know this isn't something that's advertised, because obviously it doesn't look that great. But I'm just telling you, from a parent perspective too, I would never let my children run around on the ground or play inside the hospital if I had to bring them with me, because I know how disgusting it is. So, a quick little story to go with this. One time I was in triage, and this young couple comes in. They had to be in their early 20s, and they were carrying a car seat. And they come in to check in. The mom was checking in, and we're sitting there talking to whatever. It's like the middle of, I guess it was wintertime, so it was respiratory season. And I'm like, how old's your new one? Congratulations. And they're like, oh, they're so excited. She's, I can't remember, it was like 5 days old, 6 days old. And I was like, okay, I can't. I was like, I'm a parent myself. And I was like, I am just telling you, I would not bring my 5-day-old to the ER, especially during respiratory season, because they are so at risk. And their eyes just got huge. And they're like, oh my gosh, we were so worried about her that we didn't even think about this. Like, so, I mean, I get it. It's not like right there at the front of your head because you have like an emergency going on or someone else is sick. And so I get it, but it's just something food for thought.